It's going to be the equipment section for the thumb Spica Plaster Splint. IP free. You do need cotton, of course, for any splinting you do. Stockinette's great for good fold backs. I will be using it in the video. Rolls of plaster or slabs, either one is fine. Gloves, scissors, and some tepid water. Do not use hot water with the plaster. Ace wrap, of course, is up to you on what size. Same as the width, you'll have to adapt to your patient. And a chucks pad for easy cleanup. This is going to be the padding for the thumb Spica Splint plaster. Get your patient set up. You can use a table, you can use the bump like we're using in the video, and of course put down a chucks pad. It makes cleanup much easier and keeps the patient from getting plaster on them. I, of course, am not using gloves for the demo patient. You are more than happy to use gloves in an actual situation, especially in the ER urgent care setting. First cut, you'll want to make right there at that CMC joint, and then pull the thumb out. I will be pulling the stockinette down momentarily so it sits into that groove. Cut off excess at the tips of the fingers. You don't need it. I used a 2-inch stockinette for the wrist, and I'm using a 1-inch for the thumb. Once you make this little slit up there, you can pull that down. There's 2 techniques to 3 techniques for this thumb area. 2 techniques doing this that I'm doing. You can tuck that piece inside the hole you cut, which makes it look even neater than what I'm doing in the video. This is the technique. I prefer it's getting covered up by cotton. There's a 3rd technique where you can cut a hole and you can pull it over the wrist. That technique, some people say it's harder to pull out if the patient is going to be pulling, but I think if a patient's going to be non-compliant, they're going to rip it apart anyway. So it's up to you on which technique you want to approach that, but this is the one I'm showing in the video. End point is that IP joint, so I am going to give it 3 layers of padding, so when I move that IP joint, it won't be hitting. I am then going to go around the palm, and even though there's not normally a hard plaster in the front because this is not a volar, but say they do add a volar component to the thumb Spica, then you'd want to do 3 layers there too. Then ripping through here, the 2-inch does not get as much area covered. You can use 3 or 4-inch cotton, and as you continue down, try to stick to the 50-50. Even in the video, I decided to switch my cotton to a 3 because going down with 2-inch does take a lot more time. But maintain that 50-50 of coverage, 50% cotton overlaps, no shadows. And then when you get to the bottom, again, it's going to be an end point, 2 fingers where your plaster will end. So make sure there's 3 layers there so that the patient doesn't get that plaster at the end digging into them. Now you want to position. Get them ready for the plaster component in a cup position, unless for some reason the doctor, of course, orders it an extension for some kind of laceration of a tendon or something. But that's pretty much it for the padding. On to the plaster. This will be the plaster component for the thumb Spica. We already have the patient, of course, padded, ready to go from the padding section, still in good position in that C cupping. I will be rolling this plaster out. I am not going to do that in the video. I'm going to go to the side onto the desk and just roll this out. But you want to get your measurements. The measurements are 2 fingers from that elbow crease all the way to that IP joint is where I measured to. Once you get that, you want to get at least 10 to 15 plaster sheets. Once you got those 10 to 15 sheets, in the video I'm not using that many because this is just a demo. You want to wring it out nicely and then laminate it down using your thumb and your fingers to fill in all the pores of the plaster. You do not want to just slap it on wet, or I've seen recently somebody slapped a splint on dry, didn't even wet it. That does nothing really because you didn't activate it and it didn't solidify, so just a whole bunch of separate pieces. But I'm pointing out the IP joint, that's where you want to go around. Another thing to be wary is you don't want to connect it. You don't want the splint connecting around the thumb and turning it into a cast. It is a splint. Swelling is still a really big concern, more so than stabilization even. So once you get that secured, I ripped the cotton a little bit up here, which is just to see that I made that IP joint because I want it free for that top part of the joint to move. Once you fold it down, you can tell if you made it. I normally have the patient wiggle it to make sure that IP is fully free. You can see it. it's free, the line's there, and when they wiggle, they got full access to the joint to move. The rest I'm going to laminate down, and then I'm going to be ready to anchor it down with some more cotton, because you cannot leave it like that. You could do fold downs here and make it harder for a patient to take it off if you wanted to. By doing fold downs now and then just wrapping ACE wrap on the plaster, it would make it hard for the patient to get it off if they're like a non-compliant patient. But I lifted the stockinette back up, and now this is called anchoring. You just need one layer to cover up the plaster so it does not get stuck and make it difficult to take it off with the ACE wrap. And once that's done, your plaster section is done. This is going to be the final section for the Plaster Thumb Spica Splint. We are going to be folding and finishing, folding the stockinette and the cotton over the plaster, and making the edges nice and neat for the patient so the cotton and stuff isn't just coming off from the edges. As you see, I'm folding the cotton individually. This is something I recommend. Even if you just did this straight cotton, I would recommend folding the cotton, making it extra long so you can fold it back over that plaster. What you don't want is the cotton to either bunch up underneath or not have any cotton at the edge, where that can cause a skin issue and rub into the patient's either bicep or into the forearm or anything like that. You don't want issues. The next cut that I just did at that joint was to help me pull it over the thumb. And then you see kind of the palmar crease is visible in the hand. There's nothing rigid there anyway. And the rigidity is all down that back of that thumb, down the CMC joint area. Next, I'm going to start my ACE wrap at the wrist, making a small, about halfway through cut through the 2-inch ACE wrap, and then coming right through to secure it all down for that thumb. Next, I'll come around and go through the palm because you want to secure the front, which you can't see in the video currently because the front had a gapping. So you want to close everything down that has stockinette. You could also tape the stockinette if you didn't trust the patient. Lightly tape with paper tape or silk to hold down the stockinette inside, and then overwrap it with ACE wrap. I did, however, at the end here at the bottom, run out of ACE wrap. Didn't have to get another one, but I wanted to finish it. There was a huge section that didn't have ACE wrap. So for this, at the bottom section, we did do the 2 fingers from that elbow crease. So I will continue finishing with this 2-inch ACE wrap. Also, make sure that this position, that the patients are not deviating on you. Plaster does take 10 to 15 minutes, depending on the tepidness or the lukewarmness of your water. Remember, no hot water. So it will take some time to dry, so you will be holding this arm. You don't want them to deviate from that cup position. Of course, if you were told to put them in a different position per order, of course, follow your doctor's orders and discretion. But the final test for this one in the cup position is to grab the roll. And as you see, easily grab the roll. And we're going to get our last 360 view and release our patient off to healing out of this demo splint to go. And that is pretty much it. All done.